I'm Marlon Hunter, and I serve as the President and Chief Executive Officer of ReGenesis Healthcare. Our organization has been around for 16 years. We have 8 community health centers in 3 counties, in Spartanburg, Cherokee, and our newest location in Union counties. We have around 150 staff members, and we all work together to provide access to care regardless of an individual's ability to pay or inability to pay. Our goal, in partnership with the federal government and in partnership with the communities that we serve, truly is designed around providing comprehensive primary care, in an effort to make sure individuals have a medical home. Well, as a new, leader for ReGenesis Healthcare, I had the opportunity to assess the knowledge, skills, and abilities of the leadership team that was here when I came in. And we had to go through an on-site assessment with the federal government as well. And so in the vein of trying to make sure the organization was in compliance, I also, as a new CEO, kind of took that opportunity to fully assess the entire organization rather than fragmenting the process across a long period of time. Since we were already going through change and going through an assessment, I felt like it would be most ideal to just go ahead and conduct an assessment right away. I have an entirely new executive leadership team. And so this Leadership Institute, and I've been through many before, I felt like would be the answer to getting our team working together toward our common mission, vision, and values. I really feel like the Leadership Institute would present an opportunity for all of those leaders to learn how to work together more intimately and professionally as a team toward common goals. And we're kind of a deadline-driven organization in terms of compliance and those things we need to work to achieve. And so the best way to do that is to really focus on teams and that team approach. I was reading about Dr. Woodard's profile on LinkedIn, and I had something pop up in the feed about some work she was doing, and I knew that I wanted to take our organization through a leadership development program. I saw what Capstone was offering and really viewed it as an opportunity to take the entire organization through a Leadership Institute at one time versus sending individuals one at a time. So based on the information that I read, I really felt like it would offer us to just kind of kill, many birds and issues with one stone by inviting her to come in. So when, I gave her a call to talk to her about what I was trying to achieve, she was right on board. And then secondly, I grew up in this area, and after I graduated from high school, I went off to college and started my career in other states. And but growing up in this area, I knew Dr. Woodard, and I watched her go away and do very well in her career. So I was just so thoroughly impressed with what she had achieved, and I just felt like with her background and knowledge and skills and abilities, in this area, plus being from the area, added value to what I wanted to see our organization work to achieve for Spartanburg. Well, the ReGenesis Leadership Excellence Institute, is an opportunity for our leaders to learn, new leaders, by the way, to learn how to work together collaboratively toward a common goal. I feel like learning and working in teams is key across the healthcare industry. It has become very politicized, and it's requiring a lot of attention across a variety of professional disciplines, to include legal, finance, IT. And so what better way to pull all of those disciplines together so that we can work towards a common goal and a common mission. And this is what I really believe, we'll work and be able to achieve with Capstone. Our leadership team at ReGenesis is broken up into two areas. We have just our leadership mid-level leaders, and then our executive C-suite leadership team. And I decided that I wanted our entire leadership team to go through a very similar leadership experience. And if we could do it all together, that would be much better and much more cost effective. That's what Dr. Woodard and Capstone has offered to us, which has just been phenomenal. I have seen progress. I have seen results. Dr. Woodard, as a part of this program, has offered, one-on-one coaching. I just think that's awesome. She also offered a 360 evaluation as well, so that individuals could go in, evaluate themselves, and ask others, their peers or friends, to evaluate them. And then take that 360 evaluation and then apply it to their day-to-day lives and their day-to-day work. And so I'm getting feedback from all of the individuals who have worked with Dr. Woodard one-on-one, and they just really love her and the way she has worked to guide them and coach them and counsel them about what they're here to do every day. The feedback has just been overwhelming and positive. So that is certainly what I was looking to achieve, especially as we were working to build this cohesiveness and this camaraderie and this team around teams in the organization. That's exactly what I wanted to see us achieve and accomplish. I'm really hoping the end game around all of this will lend itself towards a team that understands one another, that's comfortable with one another's opportunities, strengths, our weaknesses, and our threats, but at the end of the day, knowing that we are all working together for a common goal to improve health outcomes for people that need us the most. I really feel like all companies can benefit from a leadership institute. I really, really do like what we're going through here with Capstone and Dr. Woodard. And so there are many, 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 I think, opportunities that an organization can gain by going through this Leadership Institute, and I feel like everyone at some point should take advantage of it.